Pregnancy is an exciting and life-changing experience, but it comes with its own share of risks. While some pregnancies progresses without complication, it is advisable to be aware of the danger signs if you want to prevent complications. In today's video, I'm going to be discussing the most common danger signs that might occur during pregnancy, so you can take action if you or anyone close to you is experiencing them. Trust me, understanding the danger signs of pregnancy will make a lot of difference in the health of the mother and child, in the sense that when you notice the danger signs of pregnancy early enough, it will prompt you to go see a doctor immediately to avoid further complications. Severe abdominal pain. If you feel severe abdominal pain during pregnancy, the reason why I said severe is because sometimes you might feel mild cramping during pregnancy, which can be considered normal. But when it becomes severe and consistent, it isn't normal. You should go see a doctor, especially when you feel the pain towards one side of your abdomen or the pain radiates to your shoulder. You should go see a doctor immediately, because this might be a sign of miscarriage, ectopic pregnancy, or some other complications. So you should go see a doctor. If you notice heavy bleeding, this is different from bleeding as a result of implantation. Implantation bleeding occurs during the first 2 weeks of pregnancy. Anything past 2 weeks of pregnancy shouldn't be considered implantation bleeding. So if you notice bleeding during pregnancy, do not stay back and say maybe it's implantation bleeding. No, you have to go to the hospital immediately, because bleeding during pregnancy is a serious condition. It might be as a result of miscarriage, it might be as a result of placenta previa, placenta abruptio. Placenta previa is when the placenta implants on the opening of the cervix, thereby causing bleeding. So placenta abruptio is when the placenta prematurely separates from the walls of the uterus. So if you notice bleeding, go to the hospital to confirm that all is well. Now, this video is not to scare you. This video is to make you sit upright and be conscious during pregnancy. Pregnancy is not a disease, but it is a condition where you have to be at alert. If you are feeling severe and persistent headache, you should go see a doctor immediately, because this could be a sign of high blood pressure or preeclampsia. You shouldn't do self-medication, you shouldn't self-medicate, because preeclampsia is a very critical condition that needs immediate evaluation and treatment. Mild swelling in the feet and ankle might be considered normal. When you notice sudden and severe swelling in the hands, the face and feet, it could indicate preeclampsia. Painful urination or bloody urine points to UTI, which if not treated could result to kidney infection or preterm labour. I have a bonus point. This bonus point is for everybody. Do not hold back your urine. Do not hold the urge to urinate. When you feel pressed, you should go urinate immediately, because over time this could cause backflow of urine to the kidney and cause kidney infection. To say thank you for this bonus point I just gave, please subscribe to my channel, like and share this video. High fever during pregnancy could be a sign of infection. If your temperature is 8.3 or goes higher, then this could be a sign of infection, especially when it is accompanied by chills, when it's accompanied by malaise, like general feeling of unwellness, or when it's accompanied by fatigue, like you're tired. I know naturally one of the symptoms of pregnancy is fatigue, that's tiredness, you're always low on energy. But when it becomes too much and it is accompanied by other symptoms like high temperature, chills, then you should take this seriously. I know it is natural for pregnant women to gain a lot of weight, but when it becomes sudden, like it's no longer add weight gradually, like it becomes sudden, then this is a danger sign. Why some cases of nausea and vomiting will be normal. Persistent vomiting during pregnancy shouldn't be joked with. Persistent and severe vomiting during pregnancy shouldn't be joked with. Notice that food doesn't stay down. This could be a case of hyperemesis gravidarum. It's a condition that comes with pregnancy. So you should run to the hospital, because in no time you might start feeling dehydration, you might start feeling general body weakness, and you might become malnourished because you can't eat, because you don't eat properly, you don't eat, you don't take in the necessary nutrition that is needed as a pregnant mother. If you notice there's an absence or decreased movement of your baby after 28 weeks of pregnancy, you should immediately go to the hospital to be examined. If you are experiencing shortness of breath, like you find out that you are more conscious of your breathing. You find out that when you are breathing, you are conscious, like on a normal day when you are breathing, you are not even aware that you are breathing. But while pregnant, you notice that you are having this conscious feeling. Like your consciousness is telling you that I'm breathing. Then this is a problem. Contraction before 37th weeks is not something you should joke with, because it could be a sign of preterm labour. Now, the contraction is different from your fetal movement. Contraction before 37th weeks is a danger sign you shouldn't joke with. It could be a sign of preterm labour, especially if it is accompanied by pain, or if it occurs within 10 minutes interval. So when you notice this, when your gestation period is not up to 37th weeks, then you should run to the hospital. Even if your gestation period is above 37th weeks, this might be a sign of labour. So this is also a sign that you should go to the hospital. We have come to the end of this video. I hope you enjoyed it. I hope this video was educative and impactful. Please support me by subscribing to my channel and liking this video. Thank you.